Welcome to the Arista MD webinar, Doing More with Less, Referral Strategies to Reduce Administrative Burden. My name is Kate McDonald. I'm the Marketing Director here at Arista MD, and I will be your host for just a portion of the call. Actually, Jeff Taylor, our product lead, is going to do the greater part of the presentation because he is indeed the expert. I'll give you just a snippet of my background. I've been in the healthcare industry since the very beginning of my career. I'm not going to reveal how many years that is. I have worked in a couple of other fields briefly, including finance, but healthcare is where my heart is, and I think Arista MD offers a really great opportunity to provide services to patients that wouldn't normally have access to specialty care. Jeff, would you like to introduce yourself?
Absolutely. Hi, everyone. I'm Jeff Taylor. I lead the product development team here at Arista MD, including the strategy and enhancement of our platform as we partner with specialty care clinics to help them deliver the best possible care for their patients and navigate many workflow challenges and hiring capacity strains that so many organizations are facing today. I joined Arista MD nearly 2 years ago, having previously worked on patient engagement and care coordination in a large regional health system, and I also bring about 10 years of experience navigating and improving workflows in highly regulated environments. Thank you all for joining. I'm really excited to spend some time today exploring some of what we see as best practices to improve and streamline referral management in the specialty care setting.
Great, thanks, Jeff. So we're going to get started. I'm going to kind of frame things up for you. We know that nearly 2 million healthcare workers quit this year. That followed a year that was even more challenging because of COVID, which has created a great deal of burnout, not just for physicians, not just at the hospital level, but also for administrative staff, referral coordinators, nurses, everybody within the healthcare industry, I think myself and Jeff included, because when all of this was going on, especially working for an organization that offers tools to streamline the process, we've all been stretched thin. So we're very aware of the challenges that practices face in terms of managing their staff, as well as managing new team members that come in and getting them up to speed. We also know that the staffing crisis is costing your patients and your practice. So we are here to help. And while we are going to focus on our own platform, the strategies that we offer today, I think really apply regardless of whether you're using a completely integrated technology or you are using a traditional manual process. So let's talk about that manual process for a minute, because I think this is where a lot of you see challenges related to staffing turnover. Truthfully, a lot of practices have already recognized that managing the referral process, incoming referrals, is a challenge. This picture, it's a classic view of a specialist clinic. One staff member is checking in patients, a referral coordinator sits in the background, they're reviewing new referrals, they're getting up and going to the fax machine. If someone needs a break or is on lunch, they might fill in for the receptionist. That said, we know that referrals, they drive the healthcare for patients. They're the way that a patient gets specialty care. They need that referral from a PCP, from a hospital, from a community clinic. And when they come in, sometimes they come in digitally, maybe by email, but most often we see them coming in through fax as hard copies. All of these types of referrals have to be digitized, centralized for scheduling, and they have to be reviewed by your team. So let's talk through those steps. First, it's an administrative step. It's time consuming. They gather the information about the patient's condition. The referral coordinator confirms the patient's history is complete. Often that step alone requires them to contact the PCP's office because, the fax comes through and part of the page is missing or whited out. It's slightly faded. The paper got jammed. There's 1,000 reasons. why that fax machine won't produce exactly the documentation that you need for incoming patients. You know, they're going to try to determine, your referral coordinator is going to try to determine if the patient's insurance is accepted. Often they need to validate that it's accurate insurance information. Because while we'd like to believe the PCP's office is able to always keep that information up to date, they do try. It's not a perfect process. And then they need to evaluate if this service is available from the specialty care practice, or even a particular provider. So you might have, if you're an orthopedist or an OBGYN, you may have a series of subspecialties listed under each physician. So your referral coordinator is working to kind of manage, exactly which physician is the right match for this particular patient's condition. So after they've completed this manual process, the second step is kind of a clinical triage. Maybe a nurse reviews it, maybe an administrator reviews it, but it's really to determine the urgency and the priority. And the priority dictates whether the patient gets an appointment now or sometimes 2 or 3 months from now. And I only say 2 or 3 months from now because we normally rely on like Kaiser Family Foundation or Merritt Hawkins to provide some data about wait times. But with the COVID pandemic, a lot of that data we haven't been able to gather. So Arista MD went out to try to determine in the markets across the country, what are the wait times? And one of the things that we found is, depending where you are and what specialty you're in, those wait times can be 30, 60, 90, and in some cases 120 days. I'm going to highlight the worst case scenarios. So for example, cardiology in Portland, you would not think that the wait time would be over 120 days. Now, I'm not saying that if you have AFib or myocardial infarction, you're not going to get to see your doctor right away. But if you have an emergent condition that needs insight from a specialist, that wait time is really going to impact your care. We're also seeing long wait times in markets that we would have never suspected. For example, Kansas City. You wouldn't think that this would be an area where endocrinology and rheumatology would have such long wait times, but they really do. And then the final one I'm going to use as an example, and we've surveyed probably between 35 and 40 different markets, is the DC metro area. And having went to college in that area, I was a little surprised when I saw that come back, because it is such a high density area with a large number of health systems. So people go to Baltimore, they go to Northern Virginia, they go to Washington, DC, but wait times there across multiple specialties often exceed 90 days. So when you're setting that priority, it's a really important factor in terms of getting that appointment booked. So after that clinical review, when you've taken into account that priority, the referral goes back to the admin team. And you can hear the sigh in my voice because I know what it's like to be that poor person that has to call up the patient and say, hi, we can get you in 90 days. This all occurs often before the patient even knows. So all of these conversations are happening in the background before that referral gets on, the coordinator gets on the phone with the patient and says, hey, I can't see you for 3 months. When we communicate back to the patient, that's also where some of the challenges come in. So I'm going to use that as the framework today as we focus on our agenda, which is kind of focused on how to solve these problems. And that's really our goal. Referral strategies to reduce the administrative burden. Let's reduce the time required to gather patient information. That means making sure we don't have to deal with all this faded fax machine paperwork. We're going to eliminate some unnecessary steps to providing care, and we're going to prioritize patients with urgent needs. And finally, we're going to expedite appointment scheduling. So with that, I'm going to kind of turn it over to the expert here, and he's going to talk us all through the first set of referral strategies. Let's go, Jeff.
Great. Thank you, Kate. Yeah. All of you are living this every single day, seeing the strains and the stresses on your referral coordination teams. But the high-level data just continues to be staggering. The wait times that Kate was talking about, the delays to patient care, and the sheer volume of missed referrals. We see data showing that clinicians are requesting more than 100 million referrals every single year, but the Institute for Healthcare Improvement and the National Patient Safety Foundation report that nearly half of these referrals never get filled. That cost is incredibly high, both for the specialty clinics like yourselves that aren't able to, that lose out on revenue and aren't able to treat these patients, and also for the patients while they're waiting for their appointment, while they're trying to get access to care, their conditions may worsen, and it increases the likelihood that they end up in higher cost settings like the ED to get the care that they need. And so shortening this time, making it easier to figure out exactly, is this referral appropriate? How do we prioritize it? And get the appointment scheduled for the patient is absolutely critical. There's a number of areas where we particularly see challenges that are slowing down the information gathering to process the referral. First, as Kate mentioned, is the number of faxes that don't go through, phone follow-ups and clarifications that don't happen. When these don't happen, so often your referral coordinators just don't know. They can't see that a fax didn't come through, and there's nothing they can do about it. Fortunately, with a referral management platform and technology to close that process, you can make sure that you are receiving all of the referrals that are being sent to you. With the increase in wait times, we're also seeing a lot of primary care practices taking more of a shotgun approach to their referrals. They're sending referrals to multiple specialists just in hopes that their patient will get a quicker appointment through one of them. And in the short term, that can help. Their patient may get a quicker appointment, but it introduces a significant burden on the system, and in the long term can even harm that patient. You know, in your practices, you're going to have to process additional referrals that may never turn into an appointment, additional no-shows, and all of that administrative burden is delaying care for someone else. That appointment that the patient doesn't show up for, well, that appointment could have been used by a different patient that's waiting for an appointment. And even for that patient that was referred to multiple clinics, now, what if they have multiple appointments with multiple different specialists? They very well may be frustrated, confused, and become less engaged with their healthcare, further driving up the overall costs to the system and making their care more challenging and difficult to administer. We also see a lot of insufficient and missing information on referrals. As we all know, the quality of the referral and having full visibility into the patient's health history is absolutely critical for treating the patient, for triaging the urgency of the request, and making sure that they're clinically appropriate for your practice. According to Becker's Hospital Review, almost 20 million referrals per year go to the wrong specialist. This translates directly into more administrative costs for specialist clinics, wasted appointments, and ultimately worse outcomes for patients. By finding alternative ways to gather patient information, make sure that you have the right information, we can reduce this burden. And we also see so many systems that don't communicate with each other. How many systems do your referral coordinators need to access in order to fully process a referral and make sure that the appointment is scheduled? Through scheduling tools, billing tools, insurance authorization, and patient communication tools. This is a lot that they need to handle. And it would be great to say the EHR handles everything. And you can hope that one day your EHR will, but I'm afraid that's going to be a really long wait and a lot of problems that you have to deal with in the meantime. And we just don't, most organizations just don't have the resources to wait for all of that. So what can we do through the process? How can we find solutions that will help? How can you improve your operations and address the burden and the strains and the stress that's on your referral coordination team and get these patients in to see your specialists? Well, we started this discussion with by going through how all of the paperwork moves through your clinic from the initial inbound referral out to finally getting that appointment scheduled. But let's take a moment and really visualize what happens in that process. If you were to walk over into your referral coordinator's office, what would you see? How many stacks of paperwork? How many reminders written on sticky notes and stuck to the desk or on the computer screen? How much handwritten, unorganized reminders are there floating around? Is this a process that another referral coordinator will be able to step in and finish out the in-process referrals? How much training does it take a new referral coordinator to come on board and be able to effectively process these referrals as they're coming in? And that's on the best of days. That's when everyone's in the office and things are going well. But what if someone calls in sick or someone leaves for another job? What happens when your practice is short-staffed? Do multiple team members fill in for your referral coordinators? Or are your referral coordinators forced to help with other tasks, submitting insurance claims, checking in patients, making follow-up calls to get more information? This can really slow things down and leads to patients falling through the cracks. If you're tracking patients' referrals using paper, the opportunity to lose a referral, misplace patient information, or have them otherwise fall through the cracks, a post-it note just loses its stickiness and falls onto the floor. All of these things are incredibly likely and result in patients not being seen, referrals being lost, and delays in appointments. Under the best of conditions, on average, we see staff spending an hour and a half per day calling patients, calling referring practices, sending faxes, dealing with faxes. The overall scheduling process can take 4 to 7 days to get the appointment booked. And even after all of that work, we still see 46% of referrals going unscheduled. And so it boils down to something so simple. The more paper you have in your process, the more reliance you have on those sticky notes and the handwritten notes, the more risk you have. The more risk you have that referrals going to go unfilled and that you're not going to be able to see all of the patients that are being sent to you. Referral management software, referral management platforms really do help this. It creates a centralized, secure online tool that can manage, that makes sure you get high quality referrals and manages the internal processes so that you don't have referrals that are falling through the cracks. Let's dig into exactly what that means. And that brings us to our first strategy that we really recommend and believe in. The use of online referral forms to centralize the collection of all of your inbound referrals is incredibly important. We start, as teams are so strained currently, any new tools need to streamline and reduce the amount of paperwork that they need to deal with. And so by having an online form that guides the referring clinics through the referral process, make sure that all of the information is collected and easily available, significantly simplifies the collection of referrals and the processing of the referrals and getting the patient scheduled. Because it's all centralized, it also decreases the likelihood of anything falling through the cracks. You can have a standardized process with accountability and visibility to make sure that each team member, whether they've been on the team for years or are brand new in your practice, know what needs to happen next, and that there's the oversight and accountability to make sure that it does happen. And with an online referral form that's easy to use, it can even drive more business, more referrals to your clinic and discourage the use of the shotgun referral approaches that we were talking about earlier. I mean, imagine being the primary care referral coordinator. What are you going to do? Are you going to use the easy, streamlined, friendly online referral form? Or are you going to walk over, leave your desk, and fight with a fax machine to get all this paperwork sent over? You're probably just going to sit at your desk and go the easy path. And that's good. It gets the patient in, helps make sure they don't fall through the cracks, and drives more business into your specialty practice. Our second strategy, and this also feeds into the use of that digital intake form, is to make it easy to attach and share documentation. All of that, all of those reviews, making sure that the referral is clinically appropriate, making sure that you have the information to properly triage and prioritize the referral. All of that needs clear documentation to give you a full picture of why that referral was made in the first place and what type of care the patient might need. In the study Dropping the Baton, Specialty Referrals in the United States, 70% of specialists rated the referral information they received as fair or worse, poor. While most specialists do want and need the pertinent information front and center, they can't spend hours wading through everything, but the pertinent information for the decision needs to be front and center. They do also need a full history of the patient to be able to effectively treat and manage the care for that patient, and also make sure that they're not ordering redundant tests that slow down care and add to the overall cost of care. So beyond the direct benefits of having all of this information easy to attach, easily available, and easy to review, it also reduces the burden on your referral coordination staff because they don't need to follow up with a primary care practice to try to get this information. You've already made it easy for the primary care practice to send everything in quickly, easily, and in a digestible format for your specialists. So we've talked now about ways that you can improve the information collection and save time to your existing process. But are there ways in which you can eliminate entire steps? And fortunately, there are. You know, as we look through the overall process, imagine again you're standing in your referral coordinator office, and they're going through administering the paperwork, clinical review, prioritizing the referral, and finally scheduling the appointment. How often are questions coming up that require them to do additional work, to circle back with the patient, go reach out to the primary care practice to try to get more information, or use one of the many tools that are normally used in reviewing and managing the referral? Is the patient's insurance validated prior to clinical review? When a physician or clinical team member reviews the referral, is all of the treatment information available? Are additional tests required? Each time these questions come up, it disrupts the standard process that your referral coordination team relies on and slows down the appointment booking process for the patient. So there's three main areas where a referral management platform such as ours can fully eliminate these steps in your process and eliminate the additional workload on your teams. First is addressing the insurance needs, validating upfront that the insurance information that you have for a patient is accurate and that the patient is in network. Second, we can we can offset all of the manual communication back to the referring practice and with the patient about when their appointment is and whether it happened in a timely manner. And finally, we can automate the patient intake paperwork. So if you're sending packets of information or printing stuff out for folks to fill in before they see the specialist, all of this can be completely eliminated or automated. Let's dive in a little bit deeper into that. First is validating the patient's insurance. Because the referral is coming in through a digital intake form, we can validate on the spot if that patient's insurance information is accurate and if their insurance plan is still active. That way, by the time it comes to you, you're confident that this information is accurate. And because we're executing that check on the intake form, well, as the primary care practice that can see that there might be an issue with the insurance. That way, and so often those issues are just typos, fat finger mistakes, little issues that take mere seconds to fix. And so by surfacing that validation right there when the referral is being made, the folks that are best positioned to get the correct information are able to fix it right then and there before it even causes any problems for you, your team, or your staff. Also, because we now have that validated, that accurate patient information, you're able to make sure that you're seeing in-network patients. According to Modern Health News, 79% of providers are referring patients to specialists outside of their network. And how many problems does that cause your team? You know, the patients don't show up because they know that they want to be staying in network, but the appointment's scheduled, and they don't always tell you that they're not going to show up, leading to more no-shows. And after the appointment, how many challenges do you have with payment collection because they don't want to or aren't able to pay the high out-of-network copays or deductibles? All of this can be avoided by automatically making sure that the patients are in network are in network, and you can fully sidestep this without any additional work needing to be done. With the insurance phase done, and now we're on to the communication with the primary care practice and with the patient. When we look back at the hours a day spent with phone calls, communication tools, and notifications out to everyone that's interested in what's going on, that's a lot of work on your team. With a referral management platform, all of that can be automated and eliminated as manual process. When a primary care practice submits a referral via your referral intake form, they will fully be kept in the loop as the appointment is scheduled, as the patient shows up or doesn't show up or gets rescheduled, and any follow-up appointments. All of that is handled by digital communication, email, secure emails, and a dashboard that allows them to find whatever information they need in real time without you needing to do any extra work. And similarly, with automated texts and emails that are sent to the patient to remind them of the appointment, to confirm the details, and make sure that they have the information they need to show up for the appointment prepared and on time. All of this communication and work that your staff are currently doing goes away. It happens automatically with no extra thought given. And this extends to making the patient paperwork painless. All of the forms that are being sent out, the additional information that needs to be gathered. Well, with a referral management platform like ours, you can digitize all of these forms, customize them for the specific information, the specific needs of your practice. What patient history do you need? What additional medication information do you need? What's clinically relevant about the issues that the patient is experiencing? You can email PDFs and ask people to send them back. You can have printouts that they fill out when they get in, or you can create standard forms that can be sent within seconds. They get sent to the patient with appropriate reminders ahead of their appointment, and can easily fill them out on their own schedule when they have the time to gather any necessary information and make sure that it's accurate. We've seen in practice that through our system of automated notifications to the patient, letting them know about the forms, and reminders to make sure that they fill them out, that with absolutely no additional work for your referral coordination staff, that patients will complete forms about 70 to 80% of the time ahead of the appointment without any follow-up. Even better, because it is all digital, it's typed in, you don't have to figure out what the handwritten scrawl is. I don't know about your handwriting, but mine is definitely not always legible. And so being able to have that in a digital typed out way that's easy to read and can be moved into the EHR is a easy way to alleviate more of the burden from your referral coordination staff. And so we've gone through a number of ways in which you can simplify and streamline your existing processes and even entirely replace others, so that you're already seeing a much easier and simpler referral management process. But now that you've got all of these referrals coming in, how do you prioritize patients based on urgency? As Kate was saying earlier, a lot of wait times wait times in general have increased dramatically over the last few years. There's so much pent-up demand in the system. There's so many more patients that need complex specialist care that making sure the most urgent patients, the most urgent referrals come to the top is absolutely critical. The American Journal of Managed Care reports that 52% of PCPs report making unnecessary referrals. That's often at the patient's request. And so how do you weed all of those out? That's a lot of noise in the system. That takes a lot of time for your referral coordinators to gather the right information, to share it with your clinical staff, and be able to effectively prioritize these appointments. So there's a number of ways that we can do that, that we can help with effective with an effective referral management program. First, making it easy to book appointments with patients that have urgent needs. Second is to leverage urgency flags from the PCP, letting them tell you when a referral truly is urgent and needs to be at the top of the stack. And then also make it easy to support the entire referral management process in a way that flags these accounts and keeps them at the top of the stack so that there aren't any unnecessary delays, because that sticky note that said that this referral was urgent fell off the computer monitor and got lost in the ether. So let's actually start with the second one. How can we leverage what the primary care practice already knows about this patient? With a digital referral intake form, you can have customized questions to gather information about the specific referral and the specific patient. One of the most important ones to have there is the urgency of the referral. Is it routine or is it urgent? The primary care practice has been treating this patient. They know the urgency, whereas your staff, your practice they're frequently seeing them for the first time and need to wade through all of the paperwork and all of the additional information that was provided in order to determine why the referral was sent and how urgent it was. So by giving the referring clinic, the referring practice, an easy way to flag the referral as urgent, you're able to immediately bring these to the top of the stack. Then, as you're doing your own reviews, you can start with those. And as you're looking at other referrals that are in the queue, you can make your own determination and either mark them as not actually being urgent, or if there's one that came in as routine, but in your expert opinion does need to be marked urgent, flip that flag and it comes to the top of the stack. Now, as you go through all of the tasks, the clinical reviews, the prioritization, there's still a few team members that need to be involved and some work that does need to be done to get the appointment scheduled. And so having clear organization around the tasks that need to be done, a clear timeline, a clear process. First this happens, then that happens, then that happens. And being able to tag all of those tasks to specific people who are responsible for them and specific times and due dates for them being complete is absolutely imperative. Transitioning to this might seem a little bit daunting, but it's really not. The very best in class referral management platforms will have the flexibility to allow you to implement your own process. What are the steps? What are the reviews? What are the standard things that occur on every referral? And carry that over to the referral management platform so that you don't have to take whatever process is dictated to you. The platform instead supports the process that works best for you. That also helps alleviate any transition efforts, new learning, new additional training that would be necessary. By having all of these tasks centralized, you're able to ensure that nothing falls through the cracks and have that accountability to see that the tasks are being completed and that no referrals are falling through the cracks. And now finally, after all of that work's been done, comes actually making the appointment. And if you're anything like me, if you see an and if you see an unknown number calling you, you're going to ignore it. And so, and that just leads to more phone calls that your referral coordination staff have to make, more follow-ups and delays in getting the appointment scheduled. Fortunately, we can send automated texts that can be customized for your practice that let the patient know that your staff will be calling, so that they're expecting it. That way, when that unrecognized number comes in, they're more willing to answer it, and there's fewer delays in getting the patient scheduled. So those are a few ways that we can help with streamlining your existing process, eliminating entire steps from it, and making sure that you're prioritizing the right patients. But there's even more that Kate will expand on, and getting that appointment scheduling even more expedited.
Thanks, Jeff. I think you've done a great job kind of framing everything up for me, because all of this section is going to be somewhat of a summary of some of the things that we've already talked about and how they support improved, faster scheduling. One of the things that we know is that the sooner you get a patient scheduled, the less referral leakage you're going to have in the process. And while this doesn't eliminate that much administrative burden, it does improve the bottom line for your practice, and obviously it improves patient outcomes. And as Jeff mentioned, it definitely prevents those visits to the ED. You know, we've supported thousands of PCPs and their patients across so many types of organizations. And specialty care practices, that we know the challenges that those PCPs are having getting their patients booked. And so let's kind of recap what Jeff has already presented to you in terms of strategies, and just quickly review how they help you make faster appointments and create higher volume and quality. One, an online referral form, we already know it's going to save a ton of time with the phone calls, with that fax machine. It's going to let you, strategy number 2, attach and share the documentation, which is so important. Most specialists that I've spoken to want to have the relevant and important things right up front. But when they get in with the patient and they start asking some more serious questions, they also want to be able to go look at all of the visit notes. If they need to check that medication list, if they want to double check on prior treatments, and I'm not going to go into the details, but I am one of those complex patients. So I know when they want to prescribe me something or talk me through something, they often want to go, they'll even say, wait a second, let me pull this up on the computer screen in the little cart. So strategy number 3, let's just go ahead and validate the insurance. Jeff's development team has done an amazing job. You're going to get real-time verification that's going to tell you that that patient's insurance is valid. And we're also going to know that they're in network. That's going to save the patient a lot of money. It's going to save you a lot of time, as Jeff mentioned, and it's going to help you avoid those no-shows, because every minute you waste waiting for a patient that's never going to show up, or dealing with a canceled appointment, or even trying to reschedule that appointment, that's some administrative burden. But it also means that patient didn't receive care, and you probably didn't get paid for that care. Finally, appointment confirmations. This really does impact administrative burden. The number of phone calls coming in from patients, from the PCP practice, just trying to confirm that you received the fax or the patient has been scheduled. Let's avoid all of that and do asynchronous communication directly in the secure platform. You can send an email to the practice saying, hey, Jeff at Acme PCP, we've already booked this appointment. No need to worry. This is going to save your staff a lot of time. So now I'm going to talk to you about a few things to add on and highlight. Jeff talked a little bit about notifications to patients, but I think patient forms and making that paperwork painless is really important. One of the things, and Jeff, jump in here, I think you told me 70 to 80% of these forms are completed.
That's exactly right. No additional follow-ups, no needing to call the patient to ask them to pretty please fill out the forms, just through the full automated notifications that automatically go out. 70–80% of patients are completing their intake forms ahead of time.
I really appreciate it myself. It saves me a lot of time.
Absolutely.
And I don't have to spend, I don't know, I'm sure that there are people on the call that are both working as providers and support staff, as well as your patients yourself. You've been on your cell phone trying to look up, okay, my emergency contact number. Oh, wait, what medication dose is that? I might know what medications I'm on, but is it 10 milligrams? Is it 25 milligrams? I can't remember. So then I had to log into Walgreens, try to figure out exactly what my prescriptions are. Let's avoid all of that. Let's get all of that information collected. And then when they're in the office and the receptionist is welcoming them, they just have to make that photocopy of the driver's license and the insurance card. Their lives are a lot easier, which frees them up to answer phone calls, to support the patients that are leaving the practice, to do billing, whatever the task is. And the referral coordinator doesn't have to be on the phone, backing up the receptionist. So we're freeing up that staff burden.
A while back, I was piloting digital forms with a specialty care department, which is part of a larger health system. And everyone loved it. It was easy for the patients. As Kate was saying, it was simple. It fit into their life, their day. They could carve out the time to, when they had the information on hand, for the support staff and for the specialists, the clinician. Everything was easy to read. Within just a few weeks, other departments were clamoring to get in on the pilots because they could see just how big of an impact it made in the clinic operations and the ease with which the patient could be treated and seen.
Yeah, and I think it's really interesting when we talk to the physicians in a practice.
Mhm.
Even if they're physicians that are also acting in a leadership or operational role, they often don't even realize what is going on with the number of forms that patients don't fill out,
Mhm.
or that they have to review and check through, and deal with all of the. Okay, wait, did this information change? Even your nurse are going to go, wait, the last time you were here, you said. So, sometimes it's beneficial just to stop in and ask your team, how much time do you spend dealing with the patient paperwork? So let's solve that for you. Um, let's talk about reliable tracking and communication. I think, we've hit on this in talking about urgent patients, but I think what we really want to think about is that staffing turnover. Or if somebody calls out sick, you're running on a short staff because you've had difficulty hiring to support increased patient demand. It may not be that you've lost any staff, it's just the volume of patients that need specialty care has gone up. So how do we make sure that if someone needs to pitch in, a member of the nursing team, a member of the administrative team, or if you yourself as the provider, or nurse practitioner, the physician, need to look at what's going on, who's scheduled, who's not scheduled, or open up a task, you can look at it easily and see, okay, here are the patients that are scheduled, here are the patients that aren't scheduled, here's where we're having missing information. And even in some cases, like we mentioned with the urgent, if we need to do a clinical review, you can see that task being assigned to the appropriate team member. So we're going to eliminate errors that way. We're going to, again, remove some of that referral leakage. I know that's not necessarily why you're on this call today, but eliminating referral leakage is really important in terms of patient care and also in terms of your practice development. And then, we're going to track and manage referral activity, even when the staff members leave, so we can prioritize those referrals that need follow-up. And the person coming in the door on their first day is easily going to be able to look and see new referrals at a glance. Now, we are getting close to the end of our time here, but I want to make sure we cover just a few things very rapidly about referral challenges that are unrelated to staffing. So let's just talk quickly about the challenges that we've addressed today. Longer scheduling times equal a higher likelihood of that patients won't see you or won't see a specialist. 4 to 7 days is how long it can take now. Let's make it 4 to 7 minutes, or 30 minutes would be great. Inappropriate referrals and lack of communication, this increases the patient costs and no-shows. So we want to eliminate that duplicate test. We want to get the referrals sent to the right specialist to eliminate any follow-up that's unnecessary. This is how we help you do it. We're going to try to expedite that scheduling. We're going to gather the information with customized, we call them power forms, so that when your PCPs are referring to your specialty care practice, it's super easy. If I was a referral coordinator and my choices were to sit at my desk and type it in to an online form that's HIPAA compliant, secure, or get up and fill the fax machine with paper, unjam it, send it through 3 times, these are the kind of things that I would want to do to send my referral to a specialist. We're not going to cover too much about this because I know we're running out of time. I want to leave an opportunity for questions. But, one of the things that the referral process electronically improves is also sending that patient care plan back to the PCP, which makes you a preferred provider, because so many PCPs tell us that they receive incomplete care plans. They're not sure who is responsible for patient care or when to escalate back to the specialist if the patient's condition changes. So let's send that electronically directly back to our PCPs that are referring us. Oh, little mistake from the marketing person on this slide. I will send these slides out, but these are some of the complaints that we hear and some statistics around closing that referral loop and why it's important. And then here's what it does. It maintains your relationship. It increases your volume. If you can confirm the insurance eligibility instead of flipping through your spreadsheet, if you can avoid those failed faxes and you can just really easily send over the patient history, that's the provider you're going to choose if you're the referral coordinator on the PCP side. So we want to encourage that volume. So what's your biggest referral challenge?